Right, I have a few concerns over outpatient hysteroscopy and the spread of COVID-19. A quick description of what outpatient hysteroscopy is for those who don't know. It is where a woman has an issue with either painful or continuous bleeding or other issues. So they insert a thin metal rod through the vagina, through the cervix, into the womb, fill it full of salt water, and then they have a look. And quite often followed by biopsy. Sometimes the biopsy is taken before. Now, I have seen on Twitter several posts by doctors, gynecologists, actually asking, is there an issue? Is there a reason to be concerned? There's no guidance off the RCOG, the Royal College of Obstetrics and Gynecologists. There's no guidance. There's another stuff. Now, why would you say why would there be an issue? Because they use salt water. It's used under pressure. It's relatively low pressure, but the flow rate is quite high, and there's an aerosol effect, when you get very fine droplets of water suspended in the air. Now, I've had one doctor say, well, the virus is not in the vagina. Well, that's great, but a hysteroscopy is done in the uterus under pressure with water. And there's nearly always blood, and sometimes there's quite a lot of blood, because women are told that even under all but the heaviest of bleeds, a hysteroscopy is still possible. And in fact, a preams nurse told me that it's still not an issue because they'll just keep flushing it with water till they can see something, or it's not an issue. So you are aerosoling blood into the air. There's no MM3 protection. Also, for the staff, for the nurse, the HCP, and the consultant or the nurse specialist, the fact that infection rate for outpatient hysteroscopy using the vagiscopic method is 3% and 4% under a recent VASH trial in Birmingham. Now, that suggests that the equipment's not clean, or the place is not clean, despite what they say, because they replace the rod, but they don't replace it. They don't always clean or wipe down. They certainly don't sterilise the camera stack every single time. They're meant to sheath it, but the reality is you've got spraying water, aerosol water is very fine, and the fact that the end it's not always clean, or the fact that when they remove the disposable sheath, you are transferring bacteria to. With infection rate that high, there's an obvious cross-contamination going back to and from, and also that they try to do this procedure in half an hour. The issue is with half an hour is that the place is not cleaned or scrubbed down properly. Now, it can be done with CO2. I do not know whether the equipment can take it, i.e. whether you can just swap it out or whether you need specialist equipment. The reason they haven't gone with CO2 is, one, because it's saline is cheaper, and two, to be fair, it does indigestion type pains, or it can be absorbed into the body. CO2 has been known to cause more longer term pains afterwards. But if anybody actually has some practical experience or actual, rather than guesswork, because I just keep seeing guesswork, is aerosoling blood into the air dangerous? Yes or no? Because the evidence seems to show that outpatient hysteroscopy should not be done unless you can use CO2 and the place is scrubbed down properly. And I mean properly, not just wiped down. Okay, if anyone can help, thanks.